Now look at lower limb amputations. Of course, first you define terminologies. So when you are saying lower limb amputations, it's not like you are saying talking about one amputation, right? Lower limb amputation is what? Any cut at all that I'll be doing to anything from the thigh down to my toes. If I'm cutting any part of the body there, it's a lower limb articulation. And the lower limb has many sites where you can amputate. So you have different types of amputations falling under what we call the lower limb amputations. I can cut somebody in the mid thigh. Okay, sorry, up to the hip. Okay, in the joint between what? The femur and the let's say hip bone. Okay, so that's hip disarticulation. It could be through the thigh. So that's what? Transfemoral. I'm cutting through the femur bone. Okay, it could be in the knee. Where I just cut somebody around the knee. Pap is what? Knees disarticulation. It could be in the leg. Where I'm cutting through the leg, that's what? Transtibial. Then when you come down to the ankle and the foot down, you have a lot of what? Cutting. So we'll try to define it. We'll try to list the different types and give little notes about them. Now, each one of it's supposed to actually form a different lecture later on. So when you say lower limb amputation, you should know that it's any surgical procedure where any part of the leg, okay, saying any part of the leg because sorry, let me pick a color. Just like I showed you guys, there are many sites. So they vary in levels depending on how much of the limb is supposed to be removed. And each level has unique implications. At the different parts, if they cut you at different sites, there's also a consequence. There's a degree to how that will actually affect you. Okay, so levels of lower limb amputation, you have the toe amputation, which is removal of what? One or more of the toes. This picture should explain better. Well, this one is kind of like, yeah, toes. Removing one, you have about 5 toes. So 1, 2, 3, 4, 5. So it's common in diabetes. When you have had diabetes, a lot of sugar in your body depositing the blood vessels. So you don't have a lot of blood vessels to the lower extremities, especially the toes and the hands. So the person is just becoming dried, and is chopping in. So most of the times, what they do is they go and cut it off. Because if you leave it, it will start getting dry up to the level of the waist. Okay. So if I cut your toe, it will not affect you much. So the impact is minimal. Do you understand? Then we have the transmetatarsal. I'm cutting you from this level or this level. Metatarsal is like, the toes are the ones at the top. So those long bones, these ones here, connecting like your ankle to the toes are the metatarsal bones. I'm cutting through this transmetatarsal. So it's removal across the 4 toes, the 4 foot rather, preserved heel. So at least I'm cutting you there, but to preserve this place. Yes. So it will not affect you much like somebody that they are cutting him from this level. Do you understand? So those are the basics, very important. Okay, you shouldn't go and cut a patient when you could have managed and cut little. You go and cut plenty. Do you understand? Okay, so we have the Symes amputation. I think I actually had this. Symes is what? Through the ankle. I'm cutting you through the ankle. All right. So we also have below the knee amputation. This is the knee. So anything between here and the ankle, anywhere I'm cutting you here is what? Below the knee amputation. You get that? So through the tibia, preserving the knee joint, but I'm not touching the knee joint. So the knee joint is what? Preserved. Now the knee joint is so powerful. Okay? For somebody that their knee joint is preserved and someone that they cut and you don't have a knee joint, there's so much differences. Okay? So, but the trans amputation, the trans tibia is actually one of the most common amputations worldwide. They will have the knee disarticulation where they are cutting through the knee. You have the above knee. Above knee now is what? anything from what your hips down to the knee. Anything that I'm cutting you here is what above the knee. Such people, they have a lot of issues to face in life. Okay, you depend on people, okay, to move around, to ease yourself, to bath. Life becomes so crazy for them. Then we have hip disarticulation, where there's removal of the hip joint. You know, most of the times is due to cancers, or probably you had a motor, that's a road traffic accident that they can't really manage. The tissues, they are so damaged. Then we have the hemipelvectomy, which is removal of the leg and some part of the pelvis. So you have your pelvis here, you have your leg down. This is what the hip joint. So they are now removing all the leg, plus some of the hip. Most of the times it's due to cancers, okay, or probably accidents. Injuries that actually damage that area too much. Okay, so that's what we have for the lower limb amputations.